Hello, beautiful people, and welcome to my channel. Guys, let's talk about fire stations in your Nursing and Midwifery Council adult OSCE in the UK. What are fire stations in Nmc Osce? So fire stations literally gives you an idea of what you are expected to get in your OSCE exam. It gives you literally an idea of the skills you are expected to get, of the assessments you are expected to get, and of the professional values you are expected to get, and of the evidence base you are expected to get, and even the ideas of the drugs you should give. It gives you an insight of your OSCE exam. Today, I'll be showing you each assessment and their fire stations. All right. Now, if you are interested, stay tuned.
Ryan Little.
Good day everyone, and welcome back to my channel. If you are seeing my face for the very first time, my name is Violet Okalacha. I'm a registered nurse. I live in a practice in the United Kingdom, and on this channel I share everything about OSCE, nursing, and generally about health. So please do me a favor, like this video so you don't forget right now. Share this video with as many that will benefit from it, and please don't forget to subscribe on my YouTube channel and my TikTok channel, which I'm just trying to build. All right, now before we go to the fire stations properly, I want to appreciate every one of you who have passed your OSCE exam. Guys, I'm super elated. I'm super excited. I got like over 30-40 mails. Nosvi, thanks for your help. I passed my OSCE exam. But let me just read few of them. Let me read at least 3 or 4 to encourage us that we can do it. Now, this is from my beautiful Antonia. She passed as Oxford in first sitting. I'm so proud of her. Dear Nosvi, I bring you good news that will gladden your heart. To God be the glory of the Most High God of mercy. I have passed my OSCE. Words cannot do justice to my emotions right now. I am grateful that God brought you my path. Thank you for your help in all aspects. May my God reward you. Thank you for making OSCE so simple by your teachings and encouragement. May you grow from strength to strength in Jesus' name. Thank you so much, Nosvi. The most risky part of the story is I booked my OSCE and wrote it within 3 days because that was the closest date. I took the fearless step because I was empowered by your wonderful teachings. And like you always say, knowledge is power. Thank you so much. Oh my God. I'm so proud of you, Antonia. Well done. Now, this is from Sister Linda. I'm super proud of you. She said, Nosvi, I woke up to read my emails again. It was real and I wasn't dreaming. Oh, what a selfless human you are. Your prayers, encouragement, and the shouts all put together brought this success. To say thank you is not enough. It's God who will bless you and cause the lines to fall in pleasant places for you. You went all out for me to pass my OSCE. Someone I have never met in person. You are truly amazing. I don't even know what to say again. Your beautiful Linda owes you one. Oh my God. I'm so proud of you, Linda. I don't want this video to be long. I will stop here. So if you are having issues with your OSCE, you can come and join our online training program. Our online training program is sufficient for you to pass your OSCE in one sitting. Now let me mention Fatima. Fatima says, thank you so much, mommy. Thank you so much for your unending love, support, encouragement. God perfects all that concerns you. I really appreciate. God bless you perfectly. Your blessing to generation. All the motivation I need is from you. God bless you perfectly. God bless you perfectly. God bless you perfectly. And I said you deserve this pass. So if you are interested, you've had issues with your OSCE exam, or you don't want to fail at all, you just want to pass in first sitting, our online classes are sufficient for you to pass. Now back to our topic for today. Let's talk about fire stations. Now let's say you get GCS assessment in your OSCE exam, which is subdural hematoma. So GCS assessment, subdural hematoma, they are the same thing. The kind of skills you're expected to get are fluid balance, Yes, you're going to solve fluid balance. So if you don't know how to solve fluid balance, I have a video on how to solve fluid balance. Okay, now the next skill you are expected to get is vitreal infusion phlebitis. I have a video on that. Go search it out on my YouTube. Okay, the next you are expected to get is oxygen therapy, and the next you are expected to get is peak flow meter. And your care plans, because if you have GCS, your care plan should be like pain, risks for fall, confusion, and your professional values and evidence base should be falsifying observations and ankle spray. And some of the drugs you're expected to get should be furosemide, bisoprolol, and amlodipine. All right, now let's say you have pneumonia. If you have pneumonia, your skills you are expected to get should be administration of inhaled medication, peak flow meter, Braden scale, catheter sample of urine. Yes, these are the 4 skills, because you can only have 4 skills in the Osce exam. And some of the care plan that you should do should be infection, because all pneumonia patients have greenish yellowish sputum, shortness of breath, chest pain. These are some of the care plan. Reduce mobility due to breathlessness that you are expected to do. And for professional values and evidence base, you are going to get hospital food, bedside handover. And some of the drugs you might be giving should be like oxybutynin, ramipril, and clarithromycin. All right, now let's say you get congestive heart failure, or you get heart failure in your Osce exam as an assessment. Some of the skills you're expected to get, or you will get rather, is NG tube, fine boy NG tube. I have a video on nearly all the stations. Share this video to as many preparing for their Osce exam. Trust me, they'll benefit. And please subscribe, especially to my TikTok channel. So NG tube, nutritional assessment, oxygen therapy, and peak flow meter. These are what you are expected to get if you have heart failure in your Osce exam. Now, so if you have heart failure in your Osce exam, some of the care plans you should be expected to plan for are risks for malnutrition, because heart failure patients, when you ask them, do you have any concerns for me, they tell you stuff like, I'm not eating, not violent, I don't have appetite, and majority of the times their respirations are usually on the high side. So shortness of breath, or difficulty in breathing, or breathlessness, they all mean the same thing. Chest pain, they always have ankle swelling, so risks for fall due to pededema, ankle swelling, and stuffs like that. All right, and for the professional values and evidence base, you're expected to get hospital food, bedside handover. And when it comes to your implementation station, some of the drugs you're expected to get will be furosemide, ramipril, and bisoprolol. All right, now let's say you get igunia ania as your assessment in your Osce exam. Some of the skills you're expected to get will be midstream urine, wound assessments, ANTT, and removal of catheter. So if you have hernia in your Osce exam, you might be asked to plan pre-op, or you might be asked to plan post-op. If you're asked to plan pre-op, you should look at anxiety due to unknown outcome of surgery, pain, and patient is for surgery and needs safe preparation for theater. But let's say you are asked to plan post-op, you should look at risks for infection, risks for hemorrhage, and of course pain. All right, now for the professional values and evidence base, you are going or likely to get impaired performance, saline water versus tap water. And some of the drugs you might be given will be amoxicillin, levothyroxine, and amlodipine. All right, now let's say you get ectopic pregnancy. Ectopic pregnancy is one of the pre-op cases you are likely going to get in your Osce exam. You're definitely going to have administration of inhaled medication, wound assessment, ANTT, oral care plan. Now, if you have ectopic pregnancy, you might be asked to plan pre-op or post-op, just like igunia and And for professional values and evidence base, you will be getting falsifying timesheets, fever in children. And for some of the drugs you will be given, ferrous fumarate, paracetamol, and clarithromycin. Now, let's say you have end of life in your Osce exam. The skills you will be having will be administration of suppository, bowel assessment, pain assessment, IM injection. And for the professional values and evidence base, you're likely to have impaired performance and cervical cancer. All right, now I will continue in another video. The reason is because when videos are too long, it discourages people from watching. In another video I will complete, just in case you have Alzheimer's, in case you have MAS, what you will be getting. If you find value to this video, please like, share, and don't forget to subscribe. I will see you in another of my juicy videos. Until I see you again, keep passing your Osce exam. I love you all, and bye for now.